All right, everybody. Well, we're going to get started here. My name is Steve Spraggins. I'm the area sales manager for StoredTech. This is an event that was championed by the Greater Durham Chamber of Commerce. And I want to express my sincere thanks to Tiffany Mallory, who has taken it upon herself to help me in this pandemic get the word out of different things that we feel as IT professionals are important for people to consider throughout navigating the whole COVID pandemic. Um, Together, we have cobbled together some people that I feel are here that can really help you paint a holistic view of what it's going to take to reopen your businesses. While the StoredTech story is compelling, it is only a small piece of it. And if you really want to look at the whole picture, it's important that we consider everything from both an HR perspective, a sanitation perspective, and also the technology perspective. So what we're going to do is quickly have an overview of the governor's plan and guidelines. We're going to talk about protecting your business from a human resources perspective. Then we're going to delve into keeping your environment clean. And I'm going to talk a little bit about the technology and automation solutions available to you that can really benefit throughout this whole getting back to work scenario. So this is a collaborative effort between StoredTech, Versa Business Partners, and ServPro. With us today is Darren Coble from the Versa Business Partners. He's the principal and owner. He has 20 years of HR experience at an enterprise level and a master's from the Craner School of Business at Purdue. And also joining us is Scott Green, a 30-year seasoned professional of the space. He has experience in grounds management and also a master's from NC State in history. So without further ado, we're going to go through some of the phases. So beginning on the 9th, the plan is to reopen the North Carolina economy. This all revolves around hitting some key metrics that the number of positive COVID tests are down in accordance to a ratio of people admitted to the hospital, as well as how many people in the front lines, all of our healthcare workers and essential workers in the healthcare space, have the proper PPE to be able to work effectively and safely. So the stay-at-home order is going to remain in place, but people will have more opportunities to leave and get out and about. Retailers have some considerations and things that really involve a lot of people in a communal space, like bars and restaurants, nails, salons, gyms, those sorts of things are not open yet. And all gatherings are going to be limited still. So there's also some considerations for the parks and recreations. They are also subject to gathering limits. We also want to continue the face covering as a recommendation in public. Remember that that is really not to keep yourself from getting it, as it is a collaborative effort between you and other people, that with an understanding that masks certainly do reduce the rate of transmission if everybody applies it. And then restrictions remain in place for nursing homes and other live living settings. And then, of course, encouraged teleworking. So phase 2, that would be in 4 to 6 weeks after we are successfully through the gate of phase 1. We look at continuing a stay-at-home order with strong encouragement for vulnerable populations, the elderly, immunocompromised, etc. There'll be limited openings of restaurants, reduced capacity, perhaps figures as low as 20%. Allow gatherings of houses of worship and entertainment will be allowed again. Again, face covering is still recommended, and playgrounds will be fully operational and available. And then, of course, the vulnerable populations in nursing homes, some of our community that was hit hardest, will have rigorous controls in place And then as early as June 20th, phase 3 will come about, where we can lessen the restrictions for the vulnerable populations, increase capacity at all public places, restaurants, bars, things like that, and really start to feel more like we are in a place that resembles life before we ever heard of anything like COVID-19. So I'm going to turn it over now to my esteemed colleague, Darren Coble, principal and founder of Versa Business Partners. He has really done a lot of great work in this arena, where he has been able to really do a good job of succinctly stating the facts and helping business owners understand what, from an HR perspective, needs to happen to be able to go to work safely. So with that, I'm going to unmute you, Darren, and allow you to take on your slide deck.
Thank you, Stephen. Thanks to the Durham Chamber of Commerce for having us and for letting us come and join. And Stephen, thanks for the invitation to join as well. Folks, as Stephen mentioned, I'm an HR consultant, and then I also do executive and leadership coaching. Our offices are based out of Magnolia, Texas, which is just outside of Houston, but I grew up, born in North Carolina, and we have a small office. I've got kind of a satellite office that I can set up in Burlington, North Carolina as well. And so I spend a lot of time throughout the year bouncing back and forth between the two states when we're allowed to travel. So feel free, if you have any questions, please go ahead. If you want to enter them in the chat or the Q&A box, if you're watching on Zoom, feel free to go ahead and enter those, and Stephen will keep an eye on them and let us know, and he'll insert them when it makes sense. So what I want to do is just kind of talk to the team and talk to the folks online about just things to think about as you're getting ready to start back. I know you've probably thought through some of this, but just give you a couple other checklists and things to consider as you're going through it. Well, talk about who the stakeholders are that you need to consider, talk about some of the federal guidelines, and then as you're returning to work or returning to workplace, because many of you probably have not stopped working and your teams are still out there working diligently, just in a different setting. So we'll talk about a list of things to consider as you're looking through that from an HR perspective, and then trying to move forward and think ahead in terms of business continuity as we're hitting hurricane season right now, and it's reportedly going to be pretty active. So hopefully we can put COVID behind us and move forward. So as you're looking at your stakeholders, you want to think about start from I encourage organizations when I'm working with them to start from the top. Think about the leadership team and partner with your health and safety folks and your HR folks, if you have them, to evaluate who are we communicating to and who are we going to talk to. And so employees are obviously going to be one key set of stakeholders that you're going to want to make sure you're communicating to frequently, and especially as you're kind of getting started and getting going back. And then you also have your suppliers, your contractors, your vendors, your customers, your for a lot of what Scott and Steve are going to talk about later, it's going to be your building management services groups, and just making sure that everybody understands what's expected. As it relates to litigation lately, where I'm seeing some of the hiccups come into play from an HR perspective, or where an employee or a former employee has tried to claim something and talk to every person that they could get on the phone. And I think it's important one of the first things you need to do is make sure that you identify an expert or two on the COVID-19 regulations and on the different things that are out there and what your company's doing. The reason for that is you want one person to be that stopgap for all the questions that come through, so that you can ensure that the employees are getting the same answer at the same time. And then also you as a business owner can identify any risk that might be out there where you have an employee potentially fishing for questions or answers or those kinds of things. One of the first lawsuits out of the gate as it relates to some of the regulations we'll talk about in a minute were around someone who was fishing for information, got different stories, and ended up filing a lawsuit. So make sure you've got plans around the state and federal requirements, who you need to talk to. If you can, as you're going, document those plans, just in case somebody does get sick or changes jobs or whatever else, get those documented as cleanly and quickly as possible. And then make sure you're training. And we'll talk about training and communication towards the end. And so as we move into federal and state guidelines, Stephen covered a lot of the North Carolina state guidelines that are really pertinent. I've been watching North Carolina's governor's page and everything else to see if they're going to come out with a protocol, kind of a going back to business protocol. A lot of times I've seen some of the states out there have put out kind of what's expected of individuals, what's expected of employers, and what's expected of employees. And so I don't know if we're going to see something come out from North Carolina in that respect, but if you go out to the White House's webpage, whitehouse.gov, they do have some information that is meant to target you. As you're looking at federal guidelines, where I've talked about the lawsuit earlier in the slide previously, the Family First Coronavirus Response Act, the FFCRA, is the one that folks are leveraging to kind of initiate the litigation and set the risk. This was designed to provide paid protections and leave protections for employees out there. These laws that came under the Family First Coronavirus Response Act are the Emergency Paid Sick Leave Act and then the Emergency Family Medical Leave Expansion Act. Typically, a lot of the companies that are smaller businesses do not fall under the Family Medical Leave Act because they don't have enough employees in the one location. This is new for a lot of folks that I've been working with as it relates to having to understand what family medical leave is, which is basically a protective law that allows employees to be absent if it's related to a serious medical condition and they're caring for themselves or a family member. And what's happened is the FFCRA and the EFMELA, we're going to get into a bit of alphabet soup here, the Family Medical Leave Expansion has allowed for employees that are impacted or have family impacted by COVID-19, an active diagnosis that requires care. It provides them some extra protection. And so this legislation requires that you as an employer have a specific posting up. I've provided Stephen the 2 postings, and he'll send those out after the webinar that allows you to just go ahead and have the PDFs. But to get those postings, the Department of Labor is the agency that's in charge of this regulation, and their website on this link is accessible for you to go and download those. It relates to what you have to pay under the Emergency Paid Sick Leave Act. It requires up to 2 weeks of sick leave for most employees impacted by COVID-19, and then it provides 6 different reasons that you would end up having to pay or provide sick leave for an employee. The postings describe it the cleanest that I've seen so far, and so I'm not going to go into too much detail on that. But if you get the postings and you get through this and you have questions, please don't hesitate to contact me directly, and I'm happy to answer what questions I can for you. So as you're moving through the laws and kind of understanding who it applies to, the government opened it up to the private sector with fewer than 500 employees, including non-for-profit employers. Federal agencies, I think Stephen mentioned we have a few of those that might be on the line. These laws, they apply to you no matter how many employees you have in your office. If you've done some layoffs and are thinking, well, I was at that, I had more employees than that, but now I don't, does it apply to me? Essentially, whatever the head count is as the request comes in from an employee. So through the end of the year, if you shrink or you grow, you want to keep an eye on that 500 employee mark to know if it's going to hit you or not. But you want to count your full-time, part-time, if they're working or if they're on, say, short-term disability or some sort of special leave, medical leave, and then also count your temporary employees and day laborers through a temp agency as well, which is a unique adder that was added. So we'll move into safety now. As you're looking at safety, Scott and Stephen are going to cover a little bit more information on this, but from an HR perspective, one of the biggest things to pay attention to is the HIPAA, the Health Information Privacy Act. And so what you want to make sure you're doing is you're protecting the confidentiality of the employee. If you have an employee that is infected with COVID, you're going to want to make sure that you're not communicating that person's name and that your leaders are not communicating that person's name to others. And you'll want to work with safety and the Department of Health or whichever group comes in to figure out what kind of tracing and tracking you may have to do and what kind of communications will take place there. But worst case, just make sure that you're protecting the privacy of that employee as best as you can, realizing some smaller things will be there. I encourage you to have an exposure response plan from a safety perspective. What is your communication plan when that happens? From a PR perspective, if it gets out into the news, what are you going to do? But more importantly, to your employees, how are you going to communicate to the employees? What can and cannot your supervisors say, and are they trained on what they can and cannot say to protect you from a liability standpoint there? And then here are some other just things to consider as you're going through it. From a HIPAA and a screening standpoint, there is an app that hit my radar last week, and that is the business.checkins app. And that's a pretty robust app that allows you to track the information that you need. The critical point, if you're going to do health screenings, make sure you're tracking the documentation and keep it documented in a secure file. And this app is one electronic process that you can do to keep it off of paper. As you know, it's almost time to open the doors back up, and you're working to see about who you're going to recall back, or who you're going to rehire, or who you're going to hire to get business going. If you had a layoff, you're going to want to go through some of the same procedures you may have gone through from a discrimination standpoint, to ensure that you're not having a discriminatory or making discriminatory decisions that could be seen as discriminatory. Again, intent versus impact. Make sure you're doing the statistical analysis where your intent may have no ill will. The impact of the decisions on who you bring back could have some statistical discrimination or statistical slight towards discrimination. It's up to you on, again, you've got to justify who you're going to bring back. And so the biggest thing that I've seen, advertised or conversed about and thought about is phasing the return. If you've been able to function and you've got folks working from home and they're not completely essential, you don't necessarily need to rush back. So take your time, look and bring back the folks that are critical and require tools or resources that are at work that they need to be able to get in your facilities. Work on making sure your communications, you have clear deadlines, and give as much time as you can from a notice to recall. As you're pulling folks back, if they say, I can't come back to work because I have to watch my child because my kid's not in school anymore, or the daycare is closed, be very careful and make sure your leaders are trained on this, because that is when the FFCRA can kick in. And so there is protection for parents who are caring for their child whose school or place of care is closed due to COVID-19 and the pandemic. And so you want to be very careful on that one, because there's also potential pay requirements on you for that reason. And so they're eligible for up to 12 weeks of sick leave and expanded family medical leave at 2/3 of their pay if they're staying home to watch their kids due to COVID reasons. And so it maxes at $200 a day and $12,000 total, but that's an FFCRA piece that you want to make sure you're paying attention to, especially with your frontline supervisors as they're getting information there. And so involve someone from HR or your COVID expert to make sure that they're asking the right questions and understand the situation fully. From a communication standpoint, I always encourage starting at the top, but as you're bringing folks back to work, make sure you're communicating with your unemployment office and letting them know, send them a roster of the folks that have returned, just to proactively get in front of any potential unemployment fraud or things like that. Also, it's important to do that if you've made offers and the employee has refused to come back. Let's say that they're making more money on unemployment than they would make with you. That will disqualify them for unemployment. And so it's important that you're communicating with the state unemployment office to let them know that you have provided a return to work and the employee refused. And that way, if the employee does continue to draw unemployment, it can flag it with the state, but it also can reduce some of your liability as you move forward. From a policy and procedure standpoint, I know as a business leader or your leadership team have made a ton of decisions as you've gone out and rolled out to remote work or just shut down. And so what you want to think about, a couple of the key policies is your workplace safety policies. Those are the ones I would encourage you to focus on first, and worrying about closing out the loops on some of the other things as you're moving. The remote working policy, if you made any updates there, or let's say you want to continue doing remote work, you want to work through that process. Future pandemic incidents, I'll talk a little bit more about that at the end. And then also your benefit and your personal time off, or paid time off policies. You want to take a look at those because some of those may have changed. And benefit wise, you may have telehealth that's been added and is going to be paid for through the rest of the period. So you just want to get your plan documents updated and make sure you're getting those cleaned up as the dust settles after this. As I mentioned, you may have some folks who refuse to return. And so you want to make sure you completely understand the reason they're refusing to understand if they're eligible for some sort of protection or coverage under the FFCRA. And then plan to get the request for continued telework. I think as a leadership team, I encourage you pulling your leadership team together and having a discussion from a culture perspective. If you're an office environment, you know, how has it worked? What has worked? What hasn't worked? And do we want to consider it? I'm working with one client that's a small team, and the CEO just came out and said, no way. No, we are working in the office. We are an office. Culture, collaboration, and face-to-face interaction is very important to me and a culture, and that's what we're going to drive. So it all depends on the leadership team and how you want to go. From a compensation and benefits perspective, given the timeout and given the focus of the HR organizations that I've talked to, some of the things may have kind of passed, and you may have been focused on COVID response, and some of your annual cycle processes have been put on hold. Annual pay cycles, you may have reduced pay in order to get through the G&A crunch and bind that this event has put on everyone. And so you want to take a look and at least have a communication plan on any pay reductions, on when you think they may come back, if they will come back. Pay equity, a lot of jobs are changing as you had turnover, or you've had just scope changes as you've reduced your G&A. Make sure that you do set time on the calendar to go back and look at what folks are doing and make sure that you're paying equitably across the different groups and teams. The bonus plan adjustments, if you've got a sales team, what types of bonus plan adjustments do you want to consider? And then hazard pay. Some companies are considering hazard pay. I always encourage folks to try and avoid the language hazard pay, just from a liability perspective, but ultimately you just got to figure out if you're going to provide any additional support for folks that are able to make it in or that are coming in, and or if they've been on that, and if it's time as the phases kick in to start reducing that. Make sure you have a strong communication plan if you're taking away pay. It's a very emotional issue. As I mentioned earlier on the benefits, incorporate your coverage changes. It's time to audit and true up employee premiums, as folks may have been furloughed and not getting paid, but still on benefits. There's going to be that employee premium true up that you're going to need to try and figure out if you're going to take that from future paychecks. Same with flexible spending accounts. You've got to update that program for over-the-counter medications, paid leave in the FFCRA, what policies need to be looked at, 401k, pensions, loans, all of those kinds of things are things to kind of put on your list of, you know, here are the things we just need to make sure we have someone looking at and getting through. The importance of training here is pretty critical, especially as it relates to safety and the what ifs. As you're getting your safety policies written, as you're looking at the FFCRA, I can't stress enough the importance of just communicating with your frontline leaders, especially, you know, your team leads and the folks that they just need to know the marching orders and know the parameters, and just educate as much as you can, answer questions, and educate some more is my recommendation. Just make sure your leaders are trained on some of these regulation changes that have come through, and more importantly, what do we do if we have someone come in that looks like they have a fever? What do we do if they're coughing? What do we do if someone calls and says they've tested positive for COVID-19? And so that's where I would encourage your focus on. Again, I think safety is one of the critical, safety in your safety processes is one of the most critical areas to focus on for now. And then communicate. If you've got the capability to get your communication plan put together, do what you can. Communicate to the organization as much as you can live, Zoom, Microsoft Teams, as Stephen mentioned, those kinds of things. Follow up in email and written when you can, and just make sure you're asking for feedback. A lot of the organization probably have a few folks that if a leader called just to say, hey, what are you thinking? What do you need? It helps you focus where you need to focus for the employee base. You want to do as much as you can to ease the employees' concerns. The return to work timetables, the preparations for, either whatever it is they want to prepare to come back. Make sure they understand what safety protections and precautions you've taken. Scott's going to give you a bunch on that. And then just make sure you're setting expectations. Stay at home if you're sick. Do not come in. You still, as an employer, have the right to ask for a doctor's note. Don't feel that you're completely unable to require information. But if you have someone that presented symptoms and they want to come back to work, you have the right to ask for a doctor's note for a safe return. So just think about those kinds of things. And then just focus on and have the response communication prepared in case a COVID-19 case does come in positive. And lastly, as the dust settles, make sure you schedule some time and get a meeting for your leadership team and the different populations and different stakeholders, just to do a reflect and debrief. It's hard to do once business gets going and you get focused on regenerating and growing the revenue stream, but make sure you're taking time to pause and pull the team together and refresh your emergency response plans, refresh the continuity packages. Think about hurricane readiness and what do you need for that now that you're shifting. And we know those things can pop up and hit North Carolina at any time during the season. So, and then test and drill and make sure that what you've put into place works. But I always try to encourage leadership teams to pull folks in from all levels of the organization when you're doing this kind of stuff. The more perspective, the diversity of perspective from the different levels of the company can really provide you a more robust plan that hits all the points, and leadership teams don't need to think they've got to do it all. So Stephen, that's what I've brought. And as folks, if you have questions, again, feel free to enter it in. I'll be here through the rest of the webinar as well. But you can reach me at Darren@Versa, B as in business, P as in partners.com.
Awesome, Darren. Thank you so much for your contribution. It was very informative and very thoughtful. I really appreciate you carving out some time for everybody today. Next up, we've got Mr. Scott Green. I'll tell you what, this has been the biggest aha moment for me as far as a professional, where the chambers have really shown me that there's incredible power in networking and getting to know the other members of your local chamber. I met Scott at a chamber event. I was struck by how knowledgeable he was in the environmental I guess remediation cleaning space. And I was just very impressed. So when this idea came about, he was the first guy I thought of. So I'm excited to have Scott Green of Team Stevens share a bit more about the considerations you need to make in cleaning the office space to assure a safe return. So with that, Scott, I'm going to unmute you and allow you to take over.
Thank you, Stephen. I appreciate the opportunity very much. It's an honor to be here with the chamber, and Darren did a great job setting everything up. As far as he said one key word, don't come back unless you have a plan, and that certainly falls in line with what I'm going to talk about as far as understanding what the needs are to open up. There are steps to take to make sure we ensure a return to a safe workplace for both our workers, our employees, our teammates, and our clients and our vendors. As ServPro Team Stevens, we cover Greater Wake County, most of the Triangle. We have specialty training, licensed training folks who perform the services. Understanding your needs is meaning you need to take a look at the facility that you're coming back to. Is it ready to go back to business? Is it ready? Do you have the protocols in place? Because it's going to be a new way of doing business. You're going to have the first step is to come up with the cleanup scope of work, and that takes planning. You're going to have to figure out the configuration of the new workspace. You're going to want to implement the social distancing. You're You're going to have signage up to understand these new protocols, because you're really going to have to retrain the workforce. The CDC encourages cleaning of high-touch surface areas such as counters, tabletops, doorknobs, light switches, bathroom fixtures, toilets, phones, keyboards, tablets, tables at a minimum. And that also includes things that you may not think of in certain work environments, like if you're in a warehouse or flex space setting, you use forklifts or that kind of stuff. Those things need to be cleaned and sanitized on a regular basis as well. Kitchen food areas, bathrooms. If you're an apartment complex or a assisted living facility, you'll have a leasing office or an office. Handrails on stairwells, elevators. If it's a child care facility or a school, playground equipment. Fitness equipment if your office has a fitness center. These are all things that we haven't really thought that much about. You clean them once a day at the end of the shift and not worry about it. That's not going to be the case anymore. The CDC recommends the uses of a hospital-grade disinfectant, which is a lot stronger than what your common over-the-counter household cleaning products are. And to be quite honest with you, it's a lot stronger and more effective than most of the cleaning products that are currently being used on janitorial cleaning companies that are performing your cleaning services at night. And that's where the difference is going to come, is you're going to have to find someone. Not everyone is qualified to do this type of cleaning. Not everyone adheres to the LLCRC standards. Does that company have proper insurance coverage to reduce the liability? Because the liability will be the business owner of the facility. Those are things that you have to look for. They're suggesting things like in the office, at the high usage areas, your desk, your computers, areas where people congregate, the work cells, be clean them as many as 3 times during the course of the day. Your conference rooms, and like I said, the bathrooms. They're recommending not even using the conference rooms for the first couple weeks after reopening because of social distancing and just trying to keep the curve flat once we go back to work. Because the last thing we want is to have a relapse of a reinfection of the corona coming back into the office place, because that would be devastating to the office and to the economy, as even more so than it is right now. So those are the kind of things that are going to have to be planned and thought out, and that's going to take a team that's going to have to monitor it. You're going to have to be able to procure the proper cleaning supplies. You're going to have to figure out a way of monitoring and how to keep the building as clean as possible. And that you have to consider monitoring who enters your building. That means measuring temperatures or answering questions about where they go. You're going to want to consider having the facility clean prior to opening. And there are 3 different categories of cleaning. Category 1 is where there's no suspicion of any kind of virus having been on the building. And usually that's taken care of pretty quickly with just a mass fogging of the facility. Category 2 is where there's been a person that had to go in quarantine, a person of suspicion. You're going to want to have to hand wipe down areas where that person knowingly has been in your facility, whether it be at a vending machine, working out in the gym, at his desk, in the kitchen. Those kind of things are going to have to be identified and tracked, and those areas are going to have to require a little bit more diligent cleaning. And then, of course, the category 3 is if there's been a positive test or an outbreak in the facility. That entire facility, everything that you basically can touch would need to be fogged and wiped down. So those are kind of things that the team needs to look at. Another thing that people are not really thinking that much about right now, everyone's concerned with the cleaning of the building. They're not looking at the HVAC systems and with the condition of the air quality within the facility. We recommend strongly looking at your filtration system. Are your air filters clean when the facility opens back up? Because there has been some cases and some concern that the infection was spread by way of sitting underneath an air-conditioned vent, blowing it around. So those are kind of things that we're looking for from a cleaning standpoint. You're going to have a clear scope of protocol. You're going to want to have a professionally certified team to do the cleaning, and you might want to consider at least initially the first month to 3 months of doing business, having that deep cleaning scheduled like on a quarterly basis. just to reiterate, making sure we're getting areas that need to be cleaned, make sure they're really taken care of. So those are the things that we're looking for. Cleanup procedures generally include the persons performing the cleaning to be in that full PPE, the white suits, the ventilators, the masks, the gloves, the whole 9 yards. And those are things to look for in the company to hire. And we're here to help. Whether you choose us or not, we'd be glad to work with the chamber or the members, helping make sure their plan is ready to implement for the return of business. Because the last thing we say is we want to provide the most sanitary environment possible when we reopen, and we want to maintain that environment to the best of our ability, because that will eliminate liability to the business owner and the facility long term. So I hope in a nutshell that's helpful to you. I know it's a lot of information in a short period of time, but please feel free to reach out to us if you have any questions, if you need any advice on how to proceed moving forward prior to opening up. And I thank Stephen for the opportunity, and I'm here to help any way we can.
That's great, Scott. Thank you so much for your contribution. Did have a question come through. What certifications are needed to qualify to clean?
For something like this, you want to look something that's it's a biohazard cleanup certification, where they know basically what that does is how to mix the chemicals properly, how to distribute the chemicals properly, and the proper procedures as far as protective equipment to wear. You just don't want to send someone in there with a bottle of bleach and a rag to wipe around. There's procedures that are taught in these certification classes that explain the active ingredients in the chemicals. It explains how to properly dispose of the chemicals, because the last thing you want to do is, after you've cleaned a building, to leave the gloves or something in a trash can, or even in the dumpster on site. You want it to be stored and taken care of properly. So there are certifications that our technicians go to that go over all these things. The importance of mixing the right ratio of chemicals, because if you don't mix the chemicals properly, they're not going to be as effective. It's kind of like using Roundup. If everyone thinks if you mix Roundup stronger, then the directions say it'll work better and faster. It actually does not work at all. So it has to be, there's a measurement to be used for mixing any kind of chemical, and especially with the disinfectants that we will use.
Well, great. Thank you so much for answering that and your contribution today. So without further ado, I'm going to take over and start speaking to some of the technology available and the considerations that are being made. I've had a lot of people inquire about any automation tools or resources that StoredTech might be able to provide businesses safely reopen. If you look through all the documentation about what are the key considerations for doing this safely, and you look into some of the legalities, some of the pinch points are your employees, your visitors, so basically your vendors and your customers that would be coming through, and of course anybody that's related to or had close proximity to an employee. So I wanted to go over some of the things that are in play, if you will. Some of these tools people already have and know. Some of these tools are gaining traction in the marketplace and are relatively new. So they speak to environmental management. Scott mentioned establishing priority areas, talked about some of the automation available that reduces the amount of surface areas that people have to touch. And of course, some of those check-in and screening tools that affords an owner a little bit of a pre-screening qualification and record keeping, of course, as Darren mentioned, keeping in compliance with HIPAA, that keeps records of who came and went when, and if you presented any symptoms or if you had any exposures. So building monitoring, really basic systems of cameras now come with some pretty cool features. It's not just about crime prevention anymore, right? it's all about really managing your space and understanding things like workflows and how people move from one place to another. And are there any areas that allow you any sort of vantage points that can increase both, safety of your employees from an abatement or a slip and fall, and of course theft, but also now it's about establishing those priority high touch areas. So for example, one of our partners, Cisco Meraki, if you have their camera system in place and you're using their softwares, depending on what licensure you have, you can have basically access to heat mapping and tools that allow you to see where the most highly traversed areas are, where people congregate the most, what lengths of time people stay there, and it affords you a really good sort of at a glance understanding as to where people move within your floor plan. These are gaining extreme popularity. We're seeing a lot of people looking for solutions that can help them record efforts. That's some of the things that this would do. It keeps a historical record of any footages, things like that. So you can then, with a really solid foundation, be able to understand really what the considerations as far as, sort of spatial considerations you need to make to keep people socially distanced and establish those priority areas for cleaning. We've got a lot of inquiries about thermographic imaging. It's been around for a long time. Wanted to talk to you a little bit about the realities of this. First and foremost, anybody on this call needs to understand that there are no silver bullets to how you can use technology to check all the boxes to be able to protect the business and your employees and any visitors coming into your workspace. Industry standards are plus or minus 0.3 degrees, but there's a wide variance across price points and quality of manufacturers. So if you want to use this as one of your layers of security, think of it only as that. It's one layer and it's one indicator. And be sure to vet out what the tolerance is of its readings. It's susceptible to environmental changes. As Scott pointed out, HVAC considerations you need to make, that these do have some tendency to be swayed by that, depending on which solutions that you buy. So if the temperature surrounding the area changes, then it also may impact the ability of the camera to be able to do it at that given moment when, let's say, in the North Carolina heat, the air conditioner cuts on and there's sort of an incremental microburst of cooler air. And of course, there's no way to tell if individuals are managing any of their symptoms with medicine. If somebody were to take a few ibuprofen because they didn't feel very good and were feeling a little achy, but felt compelled to go to work because of their work ethic and really wanting to contribute, there's no way for you to be able to tell using thermographic imaging. We're getting a lot of inquiries about personnel management kiosks. We bring these sorts of products to market frequently, though it's funny, these were things that were designed more about automating the front desk and the receptionist type role. But now people have seen that this can do a couple things. One, it reduces the human to human contact of somebody within your organization for a safety consideration, but it also affords you an opportunity to be able to record and document the comings and goings of people in your organization. To Darren's point, you really need to make sure your solution is compliant with HIPAA regulations. The one that I have here by Meridian does have a HIPAA compliant offering, though they have a whole spectrum of different offerings given potential environments that they could be exposed to and whatever the purpose is. So it would help automate a lot of those considerations that Darren spoke to about documenting and having things on record. And of course, if you are doing this and you've selected the right tools, you can do it within a HIPAA compliant way. We're seeing a lot of supply chain shortages of these. As you might imagine, they're very popular with the idea of being able to check multiple boxes and get back to work. They do have some of those thermographic imaging, but the tolerance is so wide on these that it really isn't, you shouldn't look at it as a key feature or even a benefit. It is not strong enough for really any sort of correlation to be made. I mean, it's almost a whole degree plus or minus. So that could be a very wide tolerance difference between seeing and learning that somebody is sick and presenting with a fever and not, and allowing the wrong people in. And also, a key consideration with these is that cleaning is still needed, that if they're in the environment where people are coming and going and they're part of your monitoring approach of the comings and going of individuals, cleaning is paramount. It goes right into what Scott was saying, that this is, of course, is going to be at one of your priority areas because it's going to establish as sort of like a gatekeeper to your whole environment. So you will still need to be able to clean these appropriately. And there are many considerations at the manufacturer's level to be made for this, because if you spray it with an aerosol, for example, and you are doing that, you need to reference the manufacturer's guidelines if that's an appropriate way of cleaning it, because you could ultimately damage it and further compromise how effective the equipment is working for you. Another old school but very popular thing that we're seeing a lot of inquiries about are automating doors. Of course, new construction with the sliding doors, that is an optimal way to do it at the start, but retrofitting kits are available. You can even combine these systems with personnel management tools like the kiosk in the previous slide, where, for example, if the policy that you decide for your organization is that people must be applying the PPE, that you can establish some facial recognition that the person that is wanting to gain entrance into your organization has the appropriate PPE on, and it can verify that and then allow the automated door system to work. So there's a lot of integration, a lot of automation that's available to businesses that check a lot of boxes, from HIPAA compliance to establishing the priority areas and minimizing touch points and areas of the surface that people would routinely touch, like a door handle or a doorknob, and also allow for some security protocols by having a first line of defense of allowing who's in and who's out. Another thing I wanted to talk about is that remote work piece. This has been an ongoing thing, so let's just cover it for redundancy's sake. You may have heard this message before, but it's worth saying again. The screen sharing in the meetings spaces, such as the one we're on right now with Zoom, they're all very valuable. You can reach audiences that you've never been able to reach before in the combined setting of your home and a work remote setting. Use it at the office to reach your work at home people while the social distancing efforts continue and the multi-phased approach. And again, depending on how the culture of your business and the leadership feels about work from home as we progress through this. But there are considerations for security, and there are still vulnerabilities of many of these tools. So you need to do a really good job of vetting out what is a good communication tool versus what is a good collaboration tool. And what I mean by that is that anything that you're using to communicate basic ideas and have a face-to-face conversation, a communication tool is good. But if you're talking about things that pertain to your business that, for lack of better terminology, we might describe as secret sauce or personnel types of conversations that you may not want to have anybody else have access to, or for that matter, you want to be able to whiteboard and collaborate in real time, where people, multiple people at multiple locations have control and are able to manipulate the document for a true collaborative space. They don't all stack up the same. So it's good that you have multiple solutions depending on what it is you're trying to do. So for us, we are a Microsoft Gold partner. So we subscribe to the idea of Teams. Though Cisco WebEx is a great solution, Zoom does have a HIPAA compliant level now. You just need to be very careful about what it is you're selecting, and be vigilant in applying the security protocols. But just really quick about Teams, it's been around for a long time. There are a lot of security protocols. It's already end-to-end encrypted. They've allowed some features for live events, and you can do that collaboration that I was describing earlier. I'll give you a real example. I was speaking to my boss, who is the owner, and he lives in New York and spends his time between his home in New York and Wake Forest. And we were having a conversation while he was visiting the New York office. And we sat and we created an Excel spreadsheet together through Teams, where we created all of the different calculations. We had different considerations. He was manipulating one cell in real time, and I was in a different sheet of the Excel spreadsheet doing something else to make sure that it was actually being received properly in our calculations. And I tell you what, it was pretty remarkable to be able to sit and halfway across the East Coast from somebody and be able to truly work together about secret sauce ideas and come away, better for our time together. So that's really the end of my presentation and the presentation overall. We are at 11:55, staying within the confines of our hour we've committed. We have some reference pages that we're going to include in what we're sharing, and links and some of those posters that Darren mentioned that we're going to share with everybody that attended. Before we stop, are there any other questions? Are there comments? Any Q&A types related things that we can speak to with the remaining time we have today? The question is, what about service businesses going into other homes? What is the PPE required, and what sort of policies should we have in place? Darren or Scott, do you have any thoughts for that question?
At the very minimum, depending on the type of service that's being done, they should be wearing a mask, and if they're doing any kind of cleaning, carpet cleaning, that kind of thing, they should be wearing mask, gloves. We recommend people going into people's homes, we wear full PPE just to be careful, because you don't know the environment that you're going into. And for us, this is important to protect our employees as it is to protect the person that we're trying to serve.
I agree. I think it's, as Scott said, you've got, as a corporation, kind of look at what and how far you want to drive the protection of your employee and of the client. At a minimum, I'd follow what the state recommends and what the government recommends in the distancing and those kinds of things. And if you can't do it safely, and be careful. Go above and beyond what you think. Set the limit higher than where the minimum may be. Can.
Okay, thank you, fellas. This does conclude our hour time together. So at this time, I will be ending the meeting. If you have further questions, please reach out to Darren, Scott, or myself, depending on the nature of the question, and we will do our best to get you a prompt reply to the best of our abilities. Thank you, everyone. Have a great day.
Thanks so much, everyone. Be safe.
Agreed. Thank you.